Great, thanks for the introduction. Like she said, I'm Valeria Bauza from Aquaya, and I'll be presenting on gender disparities in water knowledge, perception, and governance in rural Ghana on behalf of my colleague, Lucia Nadal. Our study had two main objectives. The first was to characterize the distinct gendered perspectives of men and women related to drinking water in rural Ghana, with a secondary objective to inform our specific program implementation in the area. And then our second objective was to explore kind of a novel hybrid qualitative natural language processing methodology that integrated thematic analysis with these NLP techniques that utilize kind of an AI methodology. We conducted this study in 2023 in 31 rural communities within 11 districts of Ghana, and it was part of a baseline assessment before we were conducting an evaluation of a water quality intervention within this area. And we were specifically targeting small community managed piped water systems that supplied public standpipes within the communities, and in some cases they also supplied household connections. All of the water systems were managed by water and sanitation management teams that were composed of operation staff that handled day-to-day operation of the system, as well as a community water board that oversees like financial decisions and higher level decision-making. We conducted 55 focus group discussions throughout these communities, trying to conduct one focus group discussion with women in each community and then a separate focus group discussion with men in the community. And these discussions primarily focus on experiences with water, knowledge of and satisfaction with drinking water sources, and relationships with the WSMT within the community. The focus group discussions were conducted in local language and then later translated and transcribed verbatim into English, which was used for the analysis. And then we also tested water quality at taps throughout these communities and collected data on the roles and gender composition of the WSMTs. Our primary analysis was to start with thematic analysis using en vivo to kind of distill the narrative learnings and understand what was being said qualitatively, and we used an inductive and deductive coding approach and kind of got down to 6 different main thematic areas from these narrative summaries and the text of the focus group discussion. And then we took text from each of these 6 thematic areas and then input that into the natural language processing models that we were using. And so to do that for each of these 6 areas, we extracted the text and then removed everything that wasn't participant responses. So, what interviewers were saying and things like that that were other notes, all of that was removed from our analysis. We also tried to do, I guess, what's called lemmatization, which is taking words that are quite similar and combining them into one word so that we could measure word frequencies and things that were coming up quite often. So the example on the slide is that we would combine like pipe, piped, and pipes into one term. But we also did this for local names for currency would be combined with money so we could understand how frequently certain topics were coming up. We then did 3 different types of NLP analysis. Lexical analysis, which primarily focused on word frequencies that were coming up within the discussion. Syntactic analysis, which looked at co-occurrent frequencies of pairs of words that appeared frequently together. And then semantic analysis, which looked at sentiment of the discussion. So try using different pre-trained AI models to understand the emotional tone of the discussion from participants. So whether that was negative, neutral, or positive. Our first key finding was that women shared more detailed water narratives And I think this is something that, we often see when we look at gendered perspectives in the water field, but, women bore the primary responsibility for selecting drinking water sources, and also, used a variety of factors to select these sources, such as taste of the water, suitability of the purpose, its price. And this was something that came out in both discussions with men and women. And I have an example quote of sort of a woman discussing this, where she says along the lines of, I know which water is good for what purpose. Men, when they get up in the morning, they take their bath, they eat, they go to work, they don't know how you come by the water in the household. Women typically also provided sort of more detailed information about non-pipe sources. So we asked about the piped water supply that was managed by WSMTs, but these communities also used other non-pipe sources for some of their water needs, like sachet water, surface water, and women described these in much more detail. And this came out both in the narratives as well as in the NLP results. So when we looked at things like word count, unique word count, sentence count within these discussions related to this thematic area of water source landscape, they were always higher in the women's discussion than the men's discussion. And this was the only kind of thematic area in all of the discussions where women had higher counts for these aspects. We also looked at the sentiment analysis for this area. And what we found was women tended to express more negative sentiments compared to men, particularly related to non-pipe sources. And so this figure shows the sentiment for both women and men. So the men's sentiment is shown in the light blue and women's is in dark blue. And the way that you read this graph, essentially to the further left it is, the more negative the sentiment, and the further right, the more positive. And the shaded gray area in the middle is a neutral sentiment. And if you look at specific words that you can pick out, such as stream, sachet, money, break, connection, some of these different words that came up, the context around how they were discussed was typically much more negative when women discussed them compared to men. Our second key finding was that there were gendered perspectives on water quality and treatment. In particular, perceptions of water quality were often based on sensory parameters like smell, color, taste, and women more commonly shared observations of unpleasant smell, unpleasant brownish color, salty or chlorine taste. And when, for example, they also shared a lot of reaction to different treatment processes and chemicals in the water. So, there's a few example quotes on the slide, and the first one talks about how when women observe, like when they put chemicals in the water becomes whitish and doesn't taste good. So they feel they need to leave it for a while for that to go away before they can drink it. And something that came up a lot was women talked a lot about the taste themselves in their focus groups, but when men talked about taste, they often talk about how women complain about the taste. So the women go and fetch the water, they complain it doesn't taste good, but they didn't usually assign that to themselves as a feeling they had about the taste. Perceptions of the water system storage tank cleanliness and treatment effectiveness also varied among both genders. And women often shared more negative views. And so while some women expressed desire for greater water treatment to improve water safety, there was also other women that said they disliked chlorination because it made water smell or taste bad. So some said that if the water could be treated, then they would have no problem drinking it. They're not drinking it right now, but if it was treated, then they would drink it. And so there was that perception, regardless of if they wanted it to be treated more or if they had this sort of negative response to the taste, women were much more aware of the treatment. We also saw when we looked at sediment, so this is sentiment, this is similar to the other graph, except instead of looking at words, we're looking at sentiment of the discussion of quality of piped water for different communities that are on the y-axis. And the first thing that you notice is sort of the women and men circles. In a lot of communities that are experiencing the same quality of piped water, those circles are quite far apart. So, even within the same community, men and women are sort of experiencing and expressing their experiences with piped water quality differently. And in most cases, again, kind of shown where I've highlighted in red, women had more negative sentiments about the quality of water than men. Additionally, different sort of extreme sentiments were often not associated with objective water quality parameters. So we measured things like, chlorine in the water, chlorine frequency, E. coli, and in general, those didn't really have a correlation with kind of expressed sentiments, negative or positive about the water. Then our third key finding was that there was limited demand for female participation despite management frustrations. So women's representation was lower among both water system operational staff and water boards. And despite these gender imbalances, neither women nor men uniformly called for greater female representation in the WSMTs. And when they did, it was typically at later stages in the topic discussion, kind of after the discussion had made them aware of gender disparities and how women, are responsible for a lot of the water activities and have all of this knowledge. But initially, even the women kind of expressed this isn't something they care about. And so, yeah, there's a quote where they're talking about what they care about is reliable supply of water. Like when I wake up in the morning and open my tap, there should be water flowing from it. That is all I care about, and not how many women there are on the board. And both genders also expressed concern over lack of transparency, accountability, and communication of the WSMTs, like wishing there was more communication and announcements from them. And lastly, when we looked at the sentiment for consumer relationships with the WSMTs, one thing that we noticed is that, like on the last graph, the men and women sentiment were quite far apart, and now we're seeing it much more close together. And many of them are much closer to that neutral gray shaded area in the middle. So it was just, the sentiment on this was much more neutral for both genders and similar. And we also see that it really didn't reflect actual women's representation. So on the right, the shaded bar, the darker it is, the more women were on the WSMT. And you can see there's a box around 2 that had very similar sentiment among the community members, but very different representation. So just to sort of summarize some of the implications of these findings, we first found that women possess a much more negative and acute perception of chlorination-related taste and smell impacts than men, suggesting, particularly in these communities, women-targeted communication and sensitization must accompany any increases in chlorination to prevent women who were responsible for making those water source selections from switching to a different source due to taste or smell concerns. Then we also found women demonstrated a heightened awareness of water treatment practices and were more concerned over lack of adequate treatment than men. And so we couldn't really measure this directly, but the results suggest that potentially when they're in positions of authority, they could pay more attention to water quality, though there wasn't that uniform demand to increase women's participation. And then finally, we found that NLP was a useful tool to confirm findings from qualitative analysis and kind of enhance our analytical depth, sometimes providing new insights that weren't apparent in the thematic analysis. And within this study, we're considering using it further to measure change in participants' attitudes and sentiment throughout our program implementation. So yeah, thanks for listening to my presentation. I'd like to acknowledge others that contributed to this study and our funding sources. And if there's time, I'm happy to take any questions or discuss after the session.
Thank you, Valerie, for such a fascinating presentation.
Hi there, my name is Clover Demerit, I'm from CARE. Thanks so much for the fascinating presentation. Just a kind of a specific question. I know sometimes that even when there is higher levels of participation with women in water committees and water boards, they still don't necessarily feel safe or empowered to speak up. Do you know if that was the situation in this context, even if there is higher levels of representation, if women on the boards were able to actually participate or if their voices were heard?
So we didn't speak specifically to like water board members, like we didn't interview women on the board, so I can't speak to that, I guess, directly from their perspective, but that's not something that came out within our focus groups. And often when people were sort of talking about increasing roles for women on the board, they kind of assigned very specific roles that they thought women would be good on. So like men and women felt, for example, in this context, like women should be on the board to handle like financial matters. Like they're very responsible, and we want women to be in charge of our money so that it doesn't get misspent. And so there was a lot of respect for women to handle sort of certain roles. But yeah, we didn't talk to the women who are on the board directly to understand that, but it didn't come out in our focus group discussions that they felt they couldn't speak up once they were in that management position.
You had a point in your discussion about sensitization if you're increasing chlorination because women are sensitive to the taste of it.
Yeah.
So they didn't switch water sources. Do you have evidence in your data about women that when they do increase chlorination then actually do switch away from their piped water to a less safe source elsewhere, or do they continue to use it because it's the most convenient?
A lot. So in these areas, sachet water and borehole water in some communities are quite common. And so women do talk about, like, I guess within the focus group discussions, some of the women, I guess, express this need that they want water treatment, but other women say they wish they could be notified before treatment or when it happens, because then they won't use that water for several days. So they can either collect water in advance or they can go to another source, like, well, there's that chlorination. So I do think that there is that need for messaging.
Maybe the last question.
Yeah, thank you. Very nice presentation. I was interested in this use of the machine learning. How do you control for the number of responses in each category, or the extent to which the responses are coming from the same individuals, if you're looking at a big data set like that?
So I guess we don't control for whether or not responses are coming from the same individual. Within the focus group discussion, we sort of group all of the text, like from any of the respondents together, and analyze that together. So we don't, I guess, have the level of granularity of, woman 6 said this, woman 3 said that. We do have sort of like the sense of, okay, how many, like what's the word count, what's the sentence count, what are things like that? And so we can essentially, calibrate the model to like the amount of discussion that is happening to be able to compare across sort of parameters, if that makes sense.
Yeah, good.
Yep. All right. Thank you so much once again, Valeria. As someone interested in gender research, I did not expect to see an AI-enhanced study. Also, as a qualitative researcher, I'm a bit worried. But thank you so much. Next, we have Nicole Weber from Save the Children. Yeah.
Good afternoon. My name is Nicole Weber. I am the lead WASH advisor at Save the Children. So today I will be speaking on an analysis of visual communications around how do NGOs communicate about global water and sanitation issues on Instagram. As we know, substantial increases in progress towards water and sanitation coverage are needed to meet the SDG goals, and NGOs can generate support for sanitation coverage, and much research has already looked at how NGOs shape agendas and priming and so forth. And a lot of this has been done with media outlets, but less is known about the social media landscape. And when we think about the images that are used on platforms like Instagram, they can really influence public perceptions around what the key water, sanitation, and hygiene issues are, which then may impact kind of generation of support and prioritization of activities. Additionally, we're interested in analyzing the visual culture because of global health ethics in the decolonizing aid movement. We know that NGOs compete with mainstream advertising for attention from viewers, which can push people to use more sensational images, but then enters into concern the balance around ethics with these maybe strategic fundraising goals. And at the same time, so these can perpetuate misconceptions or stereotypes, so thinking about that balance. So this study was really to unpack what several major NGOs use in terms of images when it comes to water, sanitation, and hygiene. So the question is, how do major NGOs frame water and sanitation issues on Instagram? And what visual frames are or are not used when communicating about WASH issues? So Instagram was chosen for its extensive user base. There's over 2 billion Instagram users every month. And it has the ability to communicate both through images and text messages. To select the NGOs, we consulted the list of NGO Advisor, which publishes the top 15 NGO list every year. We removed the NGOs that don't work in WASH or don't have Instagram accounts and selected BRAC as the only one on the list headquartered in a least developed country. And then selected Save the Children and Doctors Without Border because they have over 1 million followers. We used API, Apify, to download over 4,000 posts from public accounts for the time period of 2018 to 2023. This was to capture the time period before, during, and after COVID-19. And then used an Excel query to retain posts with specific keywords related to WASH. Codes were assigned to each image, which was a sample of 161, and each image only had one dominant visual frame that was assigned to it. Visuals were coded drawing on previous work on Instagram images and disasters, as well as a framework around 4 levels of visual framing. Here's the inclusion criteria. So images were kept and videos and sidecars were released, or those images that used words in a way that wasn't directly related to water and sanitation, like, I don't know, my inbox is flooding, for example, and so that was removed because it's not actually related to WASH. And then non-English posts were also removed, as well as text-only posts that didn't have any photo or image. So coded for a number of variables: gender, age, whether or not the image included humans, what the location, was it inside, outside, was it a disaster response, was it a WASH frame, and so forth. So now moving on to the results. So a total of 4,644 posts were posted by BRAC, Save the Children, and MSF during this time period. And then you can see here the posts with keywords were about 180, and then several were manually removed when reviewing because they didn't meet the inclusion criteria. Moving on to one of the key variables was around camera angle. So camera angle can really display and represent power dynamics. And so most images of these 3 organizations actually used a straight-on view, depicting a power-neutral dynamic. However, one organization did use a downward angle, which would portray submission. Close-up shots were most common, which enhances emotional appeal. And this is not surprising because these accounts are, reaching a lot of people for fundraising purposes. Of the 161 images that were analyzed and coded, about 16% were coded under WASH framing, which mean that they depicted WASH as the primary emphasis in the image. And so this meant WASH behaviors, infrastructure, or services. There were some differences noted between organizations. So for example, Save the Children had a lot of photos that were framed or that really focused on education and children, which is not surprising. And then other organizations like MSF had a lot of photos that were visually framed around health. Few images depicted beneficiaries in distress compared to other frames, which is really aligned with ethical storytelling, and I do think this might be a progression we are seeing within the global health sector. And dominant frames were mutually exclusive. Water was depicted in a variety of contexts, and there were contrasting portrayals of water, both as a destructive force, such as through flooding, but also as vital for sustaining life and agriculture and food security. A few images depicted sanitation or hygiene situations. Most of the photos that were framed as that were coded as WASH actually focused on water infrastructure or hand washing. And so this misrepresentation can lead to misconceptions around WASH challenges, which could potentially then affect funding and attention. If everything you think about WASH is the water infrastructure or that it's hand washing. When it comes to gender and age, 156 images were analyzed because those were the ones that had human subjects in them. And only 4 of them portrayed elderly individuals, which there's been some recent articles about this coming out around how the needs of elderly aren't really taken into account in humanitarian responses. And so again, if that's the representation that we have such a small amount of people representing in our images, it can reinforce kind of those misconceptions. And then children were also more frequently shown with women than men, perhaps reinforcing around being a primary caregiver. Messages didn't always align with best practices, and images and captions don't always match on Instagram. So for example here, a message on school toilets was paired with an image of a mother and a child who's a toddler. So she, this is unrelated to educational settings. So I kept looking at the image, wondering about this mismatch. And another one is these children playing at a water point, and typically we don't encourage people to play with water at the source. And these are some examples. So in terms of recommendations, I think we can all agree that social media continues to play a bigger and bigger role in all of our lives. And it can really be important as communicating and narrating these global issues that are important for achieving the Sustainable Development Goal. So in this study, NGOs didn't depict the full range of WASH behaviors in infrastructure, and there was this lack of representation of sanitation and hygiene beyond hand washing. So this might impact that public attention and funding. So I think addressing those gaps is critical because it can be used as a tool for education and awareness raising. So a couple of recommendations would be that for communicators would be to work with subject matter experts and to kind of ensure a do no harm approach in terms of what WASH practices are represented and to portray really this full range of WASH services and behaviors. And then, while a large function of these accounts are to generate fundraising, and there is that strategic communication standpoint, I think we need to continue that dialogue around balancing what is ethical representation or equitable representation, and what do we want to be communicating as a WASH sector with those fundraising goals. And then for WASH practitioners, I'd say that all of us are a photographer with our smartphone, making sure that staff have that basic ethical storytelling training and communication, and balancing also the type of images that we provide to our teams. So this study looked at 3 NGOs on one social media platform and in English, and it only focused on official accounts, but I think it's also an example of how we can use big data that's out there to think and examine the WASH work we're doing and to better understand perceptions around WASH in our sector. So we can also use it as a way to get information, maybe feedback, needs and desires and expectations. So I'd like to acknowledge the photographers and staff who posted these or who shared these photos to post to the public Instagram accounts, as well as those subjects that are in the photos. And I would also like to acknowledge the support I received on the methodology from the Life Science Communications Department at the University of Wisconsin. Thank you.
Well, visual framing, politics of representation on Instagram. I think this was very exciting. Thank you so much, Nicole. We have a couple of minutes. Yeah. You want to?
It's really interesting, Nicole, thank you. Did your research look at all at gender roles around water? Like, did you ever see men carrying water or things like that? Did that get covered at all?
I didn't look specifically at gender differences in that, but but off the top of my head, I don't think I saw any men carrying water. I did see women, but I could definitely go back and look.
Hi, my name is Emily Caruso from Splash. Thank you so much for this really interesting presentation and your research. I wanted to learn from you if menstrual health was something that was represented in the images that you looked at. I know it was predominantly like very hand washing heavy, but yeah, I just wanted to hear about the menstrual health side of things, especially because it's a stigmatized topic in a lot of these contexts that we work in.
Yeah, I would say there was very few posts about menstrual hygiene, and I think it was related to like Menstrual Hygiene Day.
Okay.
And I think there was one around like displaying kind of a bag, like a kit, but not really into detail.
Yeah.
But again, happy to go back to the sample and double check that. But yeah, it was very much the hygiene was focused on like hand washing.
Yeah, gotcha. And then one other question around like the search criteria. Did you look at pictures that included quotes from the people pictured versus, you know, quotes from the NGOs working with the people? And how many photos were included with captions that had quotes?
So I only pulled the posts were only pulled from official Instagram accounts,
Okay.
and then the text was accompanying it, and that text wasn't like I didn't analyze all the text. That could be, you could analyze both. Some of them did have quotes, but it was more to see what was the main message in the text and did it align with the image.
Okay, gotcha. Great, thank you.
I can see the one.
Great. Thank you.
Yeah, hi, thank you. Incredible study. I'm Luke from Business Connect. I'm curious, did you guys happen to, in your study, go a level deeper to assess engagement rates of posts that fall within the ethical criteria that you set to know and kind of guide, you know, what maybe is best practice to gain engagement with our audience while at the same time maintaining an ethical standard?
Yeah, that's a good point. And so in terms of engagement, I think you need a larger sample size, and to test different frames would be really helpful. It was interesting when manually filtering because text only, like so ones with no photos had the highest engagement. But also you don't know if that is because of the issue. A lot of those were around the Gaza situation and crisis. So it's hard to know. And then with Instagram, you have the image and you have the accompanying text. So engagement is a little bit tricky to say, is it because of the image or is it because of the accompanying text as well?
Any other questions?
Maybe just on engagement too, is that it felt like as a WASH person, that's a step too far for me into the strategic fundraising field, and I decided to stick more in like my technical area of like how these images portray WASH. Yeah, but good point, thank you.
Yeah. Since you brought up the fact that most of this focused on water or on hand hygiene, do you have any ideas on, since this is used to like gauge, you know, engagement and donations and all of that, on how to draw more attention to issues of sanitation and menstruation beyond, you know, World Toilet Day and Menstruation Day, when obviously there are a lot of privacy implications around sanitation and menstruation that you don't have around water and hand hygiene. Mm-hmm. So how can you focus on those things in order to draw attention and to get engagement?
Mm-hmm. Yeah, that's a great question. I think there'd have to be like testing of different images again. I think there's ways, and I know we have menstrual hygiene colleagues that are experts in this, but ways that you can communicate around that in a dignified way. And the same with sanitation.
I just had a question. Considering a lot of these posts are usually done by like interns or like staff that is often like moving, even if you sensitize them on, like for example, taking that image of the school, right? they would still be floating. So like, did you have any thoughts on like how do we address this?
Yeah, I think at like all different levels, because I think like a lot of the pictures come from WASH field staff, or when a communicator goes out to take photos, they're usually accompanied with someone from the WASH. So I think kind of this basic storytelling and WASH photography ethics would be good. And I can't remember the organization, but there was someone who was running a class I saw last year online about that, like basic photo taking skills for WASH people. So I think then that could help to kind of diversify, but also maybe some guidelines as well within organizations.
Yeah. Thank you.
Thank you.
Thank you so much, Nicole. I'm sure you've inspired all of us to take a look at our own Instagram and the power lens as well. Next, we have Madeline from Emory University. Tech assistant. Can't find the mouse.
Oh, it's because it's been which way I need to go. How does that work? God, my brain, you know. Can I check that? Just double check this one for a second.
Yeah.
Good, thank you. So I am not Bethany Caruso. If you're in this room because you saw her name, I'm sorry. She's very sorry. She is unfortunately not able to be here this year. My name is Madeline Patrick. I'm going to be presenting this research on her behalf. So this research is covering women's experiences of water collection in 4 countries. And as I think everyone in this room probably knows, women and girls disproportionately shoulder the burden of water collection. Among households where water has to be collected off the premises, in 2008, so over 15 years ago, this was the breakdown of who was the primary water collector. Shout out to Rick Johnston for providing this image. Now, several years later, we see essentially the exact same breakdown. Now, there is progress. 300 fewer million households have to collect water now. So this is considerable progress. However, the actual gender breakdown of who's collecting this water has not changed. The distribution of responsibility is the same between 2008 and 2023. This has a significant effect on the amount of available time women have. An estimated 250 million hours per day are spent on water collection. This is time that cannot be spent on sleep, leisure, childcare, income-generating activity, education, anything else. And this number actually doesn't quite capture the entire scope of time spent because you don't have a water source on the premises, because what it doesn't capture is if you have to walk to a water source far away to wash clothing or bathe or anything like this. This is about well, maybe bathing. This is about water collection. And beyond who's doing it and a rough estimate of time, we don't have a lot of understanding around women's actual water collection experiences. We have time data via self-report, but we don't have it measured. Distance traveled, again, just we have rough estimates from people who might not know exactly how far away their water source is. Energy expenditure, how much weight people are carrying, or the volume of water that people are able to carry. So this research, our goal was to strengthen understanding of women's lived experiences as they access and collect water. We carried this research out in partnership with World Vision. World Vision is doing a project called Strong Women, Strong World in 4 countries, where they are, the goal is women's empowerment through water interventions, as well as empowerment interventions and economic trainings. We selected a convenient sample of women in 6 to 7 communities per country that were proposively identified by local World Vision teams in Guatemala, Honduras, Kenya, and Zimbabwe. And the communities they selected were those that were in the process of getting a water invention or those that were in line to receive water improvements from World Vision as part of this project.
Our methods, we followed women as they collected water. So we started with their home, went with them to the water source, and then back to their home. We collected interviews, some interview questions initially given at the house, and then we went with them on go-along water collection interviews, essentially, where we could interact with the environment and the participant would serve as a guide as we went on their water journeys. And this allowed for a lot of information we might not have otherwise gotten, as a participant might say, like, oh yeah, you know, this ditch is really steep, but it's even worse when it's raining, or when I have to carry water on my head, or a branch fell on me from that tree when the winds were high one time, and allowed for some more off-the-cuff, inspired by the environment questions on the part of the interviewers. We also collected observation data on terrain, if people were resting, were there wild animals around, how many people were around, things like that. And during the initial questions, we collected height, weight, and age data from women, and then we fitted them with smartwatches and used that to actually measure the time, the distance, the elevation, calorie count, all of this that was happening as they collected water or did their water work. And lastly, we also brought scales, and we weighed the items that they started out with as they were going to the water source, so at the beginning of the journey, and then after they had done their water work, whether it was laundry or collecting water, to get an idea of how much they were actually carrying. This presentation is going to largely focus on these quantitative proportions, so the data we got from the smartwatches and from the scales. So first, we spoke to 94 women across the 4 countries. The mean household size was 5.8, which I bring up because that's a pretty large household to be collecting water for. Half of them are not getting water from an improved source, and they're collecting water about every day. So to orient you, most of these graphs are going to look like this, where we have all of the countries alongside the bottom on the x-axis, and then the total at the end, and then whatever metric we're looking at on the y-axis, and we're going to show the minimum, maximum, and mean. So in terms of time to and from the water source, you can see there is a good deal of variability within and across countries. Our longest trips were in Kenya and Zimbabwe, over 4.5 hours in some places, which is about 30% of people's waking hours. So this is, again, a substantial time burden. Even in Guatemala and Honduras, where it was much lower, women in Guatemala still spending over an hour as a mean, a max of 195 minutes, and 100 minutes in Honduras. In terms of distance, our longest journey, again, was to Kenya. There and back was 15.8 kilometers, which is a lot. But our mean across all 4 countries is still over 1 kilometer. So this is, again, a substantial burden on women. And again, a lot of variation within countries and across all countries. And in terms of energy expenditure, this considers walking, the work that you're doing at the sources. So for some women, this is laundry. For some women, this is pumping at a borehole, which a lot of women described as being very laborious and difficult and frequently requiring multiple people. And in Kenya and Zimbabwe, a lot of women collected water through sand abstraction, where they had to dig at riverbeds to uncover water. So this captures that as well. And of course, your expenditure increases when you're carrying heavy weights. Our greatest expenditure, this woman in Zimbabwe here, she was tending a garden near the borehole, actually, so she would carry more water to and from the borehole and the garden, and then go back home. So she's a bit of an outlier, but still a really useful data point, because there is a community garden that a lot of women were engaged in near the water source in this community. So water is obviously a necessary resource, but collecting water is very depleting, and in a lot of these communities where it may be that women are also eating last and least, it is worth examining, okay, like, are they actually getting the caloric intake to make up for this extreme caloric depletion that they are having for water? And in terms of weight, women are carrying a lot, just on their way to the source. So before they've collected any water, these are our mean weight data. So 6 kilograms in Guatemala, 2-3, but a maximum of 23. They are carrying children, dry laundry, empty water containers, and other goods, a lot of which might be required for them to collect water. So a scoop, in Kenya, a lot of them are rolling water behind them, so ropes. A couple people were carrying manure to fertilize the garden at the source. So they're carrying quite a bit. And as you can imagine, this goes up substantially once they actually have collected their water or done their laundry. So there's a mean 15.9 kilogram added on the return journey. This is about 35 pounds. That's a lot of added weight. And for women that are doing laundry, this added weight is due to water, but it's not actually usable water. It's because carrying wet clothes is really, really heavy. And a lot of times because of weather, they don't have the option of laying it out to dry at the water source itself, the way a lot of women in Kenya and Zimbabwe reported doing. They're going to do their laundry and then it's going to rain, so they have to get it home before it rains. So then we were interested in, okay, all of this effort, the kilometers that they are walking, all the weight that they are carrying, the time that they're spending, how much water are they actually getting for all of this effort? So this graph shows that. It excludes the women who were just going to do laundry that were not collecting water, but we looked at the weight of the actual water and found that the largest quantity of water collected is actually insufficient for the mean household size. So for all of this effort, they are collecting about 6.5 liters a person, which is substantially lower than the recommended 20 liters per person to meet people's daily needs for drinking, cooking, food, hand and face hygiene. The mean volumes collected in Kenya were the lowest, where women go the furthest and spend the most time and energy. In Kenya, they were collecting a mean of 12 liters. If you recall the household size in Kenya, that was 6 people. So we're looking at 2 liters per person on average. And that's only if all of the water is being allocated to people, but we know from the qualitative data that it's also being collected for chickens and baby goats. So there's a substantial effort. They are not getting enough water for what they actually need for healthy living. So to acknowledge here, this is one snapshot of one water journey. We only went with them one time. They may be going multiple times in a day. They may be going to visit multiple different sources. This is the one journey we have. But from this, we do know that, when water, while nurturing, while critical for survival, can be extremely depleting of time, of energy, and potentially of health. And while they are spending all this time and energy, they're not actually being able to collect enough water to meet their household's needs. And this is also incomplete. We haven't accounted for terrain considerations, opportunity costs, physical and mental harms. These will be they will be mentioned in the upcoming paper. We did ask about these questions in the interviews and women had a lot to say, and obviously we observed the terrain, which sometimes was very slippery, very dangerous. There were elephants or snakes or thorns on their paths, or they were carrying uphill, downhill on sandy terrain. So there's quite a lot of robust data there as well. So the quantitative metrics are insufficient to actually capture the sheer nature of the difficulties here. And this is novel data. We've known for a long, long time that women are the ones that are collecting water, but we haven't really understood their full experience. And as we've talked about in several different sessions in this conference, what we don't measure, what we don't understand, we don't actually take action to fix. And we are not arguing that we all need to be collecting data using smartwatches, because it's obviously very resource intensive. But we do need to do a better job of centering women instead of focusing solely on child health outcomes or things that we're typically focusing on as a sector. Because outcomes such as women's energy expenditure, injury, enabling opportunities are worthy outcomes in and of themselves to be assessing. So with that, I'd like to thank our research collaborators at World Vision, including all local offices, our local learning partners that we worked with in all countries, and of course the women who allowed us to go with them on their water collection journeys and weigh them and everything they were collecting. And if you are interested in learning more about the experience to which we as a sector are or are not centering women in our programming, I invite you to come talk to me right after this at poster presentation covering women's roles in WASH delivery and research. And then on Thursday, where we are launching our guidance documents on scales that measure women's empowerment related to sanitation. So, thank you very much.
Congratulations on a fantastic research. My name is Lisa. I'm the founder of Nazafa Water Filters. We operate in Indonesia and Kenya. I have two questions. Do you have any information on the water that's now being collected? What the purpose of that water is? Like, what is the amount used for cooking? What's the amount for staying hydrated, for consumption? And then what's the amount, for instance, given to the chicken and the goats? But yeah, I know this is already challenging research. My other question is more about like the different water sources and the quality. Because my theory is if people would have an opportunity to have a water filter at home, they might need to walk less because they could use a dirtier water source, which is next door. But as that water source might be considered too dirty, they might have to spend another 30 hours to go to the perceived or cleaner resource. So it's just my sort of a theory, but I wonder what your thoughts are on that.
Yeah, really good questions. For the first question, we don't have a quantity breakdown of how much water is being used for which purpose. We did ask about what purpose they were collecting water for. So we do have, if they say, oh, this is for, drinking or cooking or whatever, yeah, we don't know from that breakdown that like, okay, well, half a liter will be used for this and half will be used for that. And I think that would be hard to collect because my guess is they probably don't know the answer to that either. It'd be really rough estimates. In terms of the second question about water quality and water treatment, we have a lot of data about that in the qualitative data that will be in the paper. So women saying, oh, like the dam water is filthy, we never use that for drinking or cooking, the river water is the cleanest, or the new borehole water, we now use that exclusively for drinking. Yeah, so there is quite a bit on cleanliness and source selection and what purpose they're using which water for.
Thanks so much. This is so interesting. I was captivated, so I really appreciate it. I had a question about the women that are collecting the water. Did they report any seasons of their life where they were no longer the primary water collector, like in the postpartum period or things like that, and how that kind of shifted throughout their ability to collect water?
There were a few components. If someone is no longer the primary water collector for their household, we wouldn't have followed them, so that would be a data gap. However, there are women that talked about one woman was saying, well, I used to be able to collect more water, but since I had a C-section, I just can't carry as much. So we have data like that. It really does seem for most people when they are 9 months pregnant, they are still going on this water journey and carrying water back. The woman in Zimbabwe, who I gave as an example for carrying manure and water to a garden, she also was carrying a baby and was stopping in nursing on the way back on her water journey. So we're really talking about an immense amount of labor happening here. There are some people who would say, oh, well, now I'm pregnant, so my husband comes with me and he helps me carry laundry back. That was in Guatemala or Honduras. But then also, well, when I'm really sick, my husband may come with me and help me draw water from a well, but he won't carry it because that's women's work. Mm-hmm. So there's a broad spectrum, and there are some women that do report at specific times being unable to carry water or having to rely on a neighbor or something like that, but we don't have any sort of breakdown of once women get to this age or if they're pregnant or whatever responsibilities within the household shift substantially.
Yeah. I found it so striking that they're the people that eat last and least. They're doing all this manual labor, and then they're also producing huge families of 6 on average. So thank you. I appreciate it.
Thank you.
Hello, thanks for a really interesting presentation. I was wondering, during the observations, were you finding that women would go to collect water in groups, or was it an individual task? And was it seen as like a social thing that they do together, and possibly like at particular times during the day?
We got a lot of variability about that. In terms of times during the day, it tended to be when the weather was most favorable. So in Kenya, it tended to be early morning because that was before the sun got too hot, and in Zimbabwe, it was actually usually later in the day because it was too cold in the morning. Most of them did not report deliberately meeting up with other women, like a planned event, but they would usually meet other women on the way. And degrees of like, all right, fully acknowledging that these women are talking to our data collectors when they're at the water point, they might be usually socializing more on another day. But we did ask about that, and we got variability. Some of them say, yeah, this is when I talk to other women and we talk about parenting and, you know, we trade tips on gardening. And then some of them were like, no, I'm there to work. I want to get this done quickly and then get home, and I'm not talking to anyone. So we got a lot of variation on that.
First of all, great study. So my question is that, did you do any cross-tabulation of the energy or calorie burn for getting per liter of water?
I don't think so, actually, but I can check and see, but that'd be really interesting, so I'm gonna make a note of it.
Yeah, so I have not a follow-up question, but just an idea, because if it is doable, then can it be also linked with the nutritional questions? The
So-
community, how?
The nutritional question, that was me commenting on what has been found in the literature in these communities. We didn't ask about nutritional intake, so we can't do that in our paper because we don't have that data.
Thank you.
But that would be very interesting, I agree.
Yeah, thanks. Echoing everyone else, this is a really fascinating study and unfortunate that it's so novel. I was wondering, did you get a sense of how these women's water journeys had changed with the effects of climate change, especially for older women? Did you get a sense of how their journeys had changed over the last 10, 20 plus years with different climate effects they might experience?
We didn't. When we were in, well, we didn't ask those specific questions. I will say in Kenya, in the Meru region, they've been having a years-long, very severe drought. So we did hear a lot of women saying, well, I used to do this, or I used to have this resource to help, but since the drought, all the donkeys are dead and we can't use donkeys to help us carry water anymore. So we definitely did get some things that are likely climate change related, but I mean, this is from one summer and we don't have the data over time to really track the climate impact. Yeah.
Hi, thanks for a really fascinating presentation. I have two questions. One is, did you qualitatively find any instances of uterine prolapse as a result of carrying the water? Because we find it especially in the hilly terrains of Tanzania and Nepal. And the second question is, do organizations work on rainwater harvesting in these areas? Because again, what we're finding is we're going ahead and building these boreholes in rural areas and not necessarily.
Yeah. Good questions. In terms of uterine prolapse, no, but we didn't ask about that specifically. We did ask about, are there health impacts or like pain or anything like that? And we got a lot of women that said, yes, my whole body hurts and I'm exhausted, or my back hurts, or my chest hurts, or my neck hurts. So we got quite a lot of descriptions of symptoms, but no uterine prolapse, which isn't to say it didn't happen. And then the second question, sorry, jog my memory. Rainwater harvesting, they mentioned it in every single community, or at least in every single country. So I am very curious. We did follow up data collection in 2 countries this past summer when this data is from Kenya under a severe drought. And then we followed up same time of year and they had unseasonal flooding. So I anticipate we might see a little bit more information on rainwater harvesting there, but pretty much everyone said, yeah, in the rainy season, it takes less time because water comes faster, or the well at my house actually has a lot more water so I can use that more, or there are streams with runoff that I can collect that are currently all dried up. So, yeah.
Yeah.
Yes, amazing study. Really loved it, thank you. Just wondering about menstruation as well. Obviously, this is one point in time, and when you said that they're walking with babies and whatnot, obviously getting your period probably is not going to stop you. But was there any talk around the menstrual cycle? And do you think it would be interesting to do this at multiple points in time across the cycle, because your like physical, maybe the physical ability or the levels might change depending on where you're at in your cycle, in terms of like weight that you can carry or how much you need, because you need more water to manage your menstruation. You know, just things, just having that menstrual.
Yeah, we didn't ask questions about that. I do think it'd be really fascinating to collect this data across the menstrual cycle, also across time and across seasons, and I would be doing this every day if we could, because I think there are a lot of potential questions we could be answering or some really interesting data we could be collecting. Yeah, they probably do need more water at the household and all of that during menstruation. We did not ask specifically about that, and when we asked about what do you plan to use this water for, no one brought up menstruation specifically, but I don't know if they would without being prompted to bring that up. So.
I just had a thought. So far, a lot of these indicators, the way we would do research is simply just trust the women, like how far you walked or how much are you carrying. And now with using so much technology, do you think this might set a new standard for researchers? And then we are then focused on just gathering this data, whereas she might still be suffering the same issue, be it any method?
A really good question. And again, as I said, like smartwatches for like wide scale monitoring, that's just not feasible. Actually, one of the aims that we looked at for the paper itself that I didn't talk about was looking at discordance between, we asked the standard, like how long does it take you to go to the water source, collect water and come back? And found that there was actually not a whole lot of agreement between what they were reporting and what we were observing. Women who went a really long way tended to overestimate how long it took, and women who went a shorter way were more likely to underestimate how long it took. I do think we need to be paying attention to that to see how reliable the data we have is, but I think probably a better way to go about doing it might be to quantify kind of what direction the bias is going and adjust accordingly. I am open to other suggestions on that. I don't know that I have the answer, but I do think it's something that we should be looking at.
Yeah, thank you so much. Yeah, one last question. Yeah.
Yeah, great presentation, thank you very much. There's a famous study in the 70s, Pures of Water, which came up with the hypothesis that there was a direct relationship between the amount of water that was collected and the distance travelled. And I wondered if you could test that with your data and see if you can find relationships.
That there's a direct relationship with distance traveled and amount of water?
Mm-hmm.
I would
different verses, yeah.
say that our data would probably refute that, because the women who were traveling the furthest, at first we thought they're traveling so far, they're gonna wanna collect as much water as they can, but actually that's probably the reason why they weren't collecting that much water, because then they had to carry it back and they couldn't. So, a lot of women are just, carrying back whatever they physically can, and if they don't have access to, donkey-pulled carts or wheelbarrows or anything like that, their limitations based on their physical health will prohibit it. So I think they would like to, but
you could test it with your data set.
I don't want to make that promise, but we could try.
Yeah. I don't think we have any more questions, but thank you so much, Madeline, for your lovely presentation.
I want to give a quick shout out to the fact that we had a lot of very interesting methods happening in the gender room. So that was nice.
Yeah, also to remind, Madeline's poster is at 13, poster number 13.
Nice. Yes, it is.
Maybe I should announce that as well. Yeah, sorry, we don't have the fourth presentation, so you're free to go.
Thank you. Hi, Simon.
Hi, yeah.
Congratulations. I'm great seeing Jimon. I went to Raleigh.
Oh, yeah, nice to meet you.
So it's really good to see your representation and great research. It's nice hearing it from like it's interesting to hear it from like I guess science perspective. I'm from Cameroon, so I grew up in communities. The experiences of women having to go and carry water and that's it's the norm, right? So it's something
But then sometimes that's just the word. Really dreading for the most part, I would say like do you like encourage words to in the head and then I'm sorry. You get I reckon you could do it for a good journey. No, don't you need a donkey? This is how you when there is an option, you gotta read the whole like thing about like how much data, like people always want to do like data is like our obsession with data is like one of the most interesting things. I was thinking about research fatigue because I thought, oh, you got one time for this, and then obviously this is bigger, so it's like the new thing that's going to happen, like how many studies can you do? That's what's like embedded in research funding structure. If you really, if you really want to have like a visa process, your funding would end when you have your visa. It would end once you finish like your scribe process, which involves going back and doing whatever, like a hand or like something. But also some of us are doing it, but people are doing it off their own, like their own back and their own initiative, like it's not embedded in the process. Writing guidelines. So what was the last one? James just went over there, which is great. Apparently it's really common, but it's just like how hard it is to get this session. But most of them just don't register. So they said like I think they said 80% of people had paid something who had done it. So like they were expecting
so much as 20% dropout. And then should we go get some of those little bits? Like wine. I actually think it's the only way to cook. You're gonna have to wine. I wondered why you were running in and out, just down wine. Let's go. Yeah, let's go.
Yeah, but good.
Not just, so there is clearly a desire to move more development, but structures yeah, there is a period of
And then this other gradient, I was seeing if she was going to have to just curious how
yes.
It would actually be interesting to see like some of does she have a yeah, so they're kind of
but it's also yeah, so it's already yeah, that's why it became like for what scale why not changing the name?
Yeah, I feel like you guys, or as much as you have any answers, questions or stuff that you know, so they are going to tell themselves.
Here is like, oh, that's a good thing. And I'm like, existing patterns that like something other than that, there is some other I don't know.
But yeah, no, there's been a lot of great stuff how Washington has come out to connect a bit more on that. And reconnecting with the humanitarian side as well. That's been a lot more difficult, even projects on things that we share. The lines are blurred now. Been a bit for a long time, so yeah. But yeah, kind of need to reconnect a bit. Figure out what's been difficult these past few years, both internally and externally. And that's a still need to find so go to said actually we had a discussion about that. I forgot already. I know yeah, so Jean can't answer for now. Then we start telling him that his own babies. That's right. But yeah, do the alteration of Mr. So you talk about dependent variable take
water sector, like at various levels. So the other thing is like we're having a hard time trying to like make sure that it actually connects to like better outcomes.
Yeah,
I mean,
it's not something
I think when we were talking.
it's interesting. And this conference in this perspective, I think it's great.
The next step of stuff like
Possible? All right, and you also have been
So for such did you get anywhere in those discussions? Like
we think it's very interesting.
yeah.